check your cholesterol as soon as possible. If you have these symptoms, the silent danger lurking in your bloodstream, have you ever felt drained, struggled with leg cramps, or experienced brain fog? While these might seem like everyday inconveniences, they could be signs that your cholesterol is dangerously high. The scariest part: high cholesterol doesn't announce itself with obvious symptoms. Instead, it quietly builds up in your arteries, leading to serious conditions like heart disease or stroke. High cholesterol is a global health concern. According to the World Heart Federation, high cholesterol causes 4.4 million deaths every year, accounting for 7.8% of all deaths worldwide. In 2008, 39% of adults around the world had high total cholesterol, and most don't even know it. By the time many people realize their cholesterol is high, it's often too late. They're already dealing with a major health crisis. But today, you're taking the first step toward protecting your health. We're about to uncover 12 hidden signs that your cholesterol might be too high, along with science-backed solutions to keep your heart in top shape. Let's dive in. First of all, we need to understand cholesterol, its types and causes of high cholesterol levels. Cholesterol is a waxy substance, vital for building cells and producing hormones. It's transported through the bloodstream by lipoproteins, primarily low-density lipoprotein and high-density lipoprotein. Low-density lipoprotein, often termed bad cholesterol, it carries cholesterol to the arteries. Elevated low-density lipoprotein levels can lead to plaque buildup, narrowing arteries, and increasing the risk of heart disease and stroke. High-density lipoprotein, known as good cholesterol, it transports cholesterol away from the arteries to the liver for removal. Higher high-density lipoprotein levels are protective against heart disease. So what are causes of high bad cholesterol? Several factors can elevate cholesterol levels. 1. Unhealthy diet. Consuming foods high in saturated and trans fats, such as red meat, full-fat dairy products, and processed foods, increases low-density lipoprotein cholesterol. 2. Lack of physical activity. A sedentary lifestyle contributes to weight gain and higher low-density lipoprotein levels, while lowering high-density lipoprotein cholesterol. 3. Smoking. Chemicals in cigarettes damage blood vessels, making them more susceptible to fatty deposits and lower high-density lipoprotein cholesterol. 4. Genetics. Familial hypercholesterolemia is a genetic disorder affecting 1 in 250 individuals, leading to extremely high low-density lipoprotein levels and increasing the risk of early heart disease. 5. Underlying health conditions. Diseases like diabetes, hypothyroidism, and kidney disorders can negatively impact cholesterol levels. High low-density lipoprotein cholesterol is often called the silent killer because it doesn't cause obvious symptoms until serious complications arise. Many people don't realize they have high bad cholesterol until they experience a heart attack, stroke, or another cardiovascular event. However, there are subtle signs that your body may be giving you, warning that your cholesterol levels are dangerously high. Recognizing these symptoms early can help you take action before it's too late. Now, we'll explore 12 warning signs of high cholesterol, the science behind them, and practical steps you can take to protect your heart health. 1. Yellowish deposits around the eyes, a warning sign in plain sight. Have you ever noticed small yellowish patches around your eyes? This condition, known as xanthelasma, could be a visible clue that your cholesterol is too high. Research from British Heart Foundation shows that up to 50% of people with xanthelasma also have abnormal cholesterol levels. Xanthelasma forms when excess cholesterol builds up under the skin, creating fatty deposits that often appear in individuals with high low-density lipoprotein, bad cholesterol, or diabetes. While these deposits themselves are harmless, they are often a red flag for underlying heart and vascular problems. If you notice these patches, it's a good idea to get your cholesterol levels checked immediately. 2. Leg pain or cramping. It's not just muscle fatigue. Do your legs ache or cramp when walking or exercising? This could be more than just muscle fatigue. It might be a sign of peripheral artery disease (PAD), a condition caused by cholesterol buildup in the arteries. According to the American Heart Association, individuals with peripheral artery disease are 4 times more likely to experience a heart attack or stroke compared to those without the condition. When bad cholesterol builds up, it narrows the arteries, reducing oxygen supply to the muscles. This leads to pain, cramping, and heaviness in the legs, especially during physical activity. If you notice following symptoms, your legs cramp that worsen with movement, or there is numbness or weakness in the legs, and slow healing wounds on the feet, don't ignore them. They could be a sign that your arteries are becoming dangerously blocked. 3. Tingling or numbness in hands and feet. Your nerves need oxygen. Do you often experience a pins and needles sensation in your hands or feet? This could be a sign of poor circulation caused by high cholesterol. This happens because cholesterol buildup narrows arteries, restricting blood flow to your extremities. This deprives your nerves of oxygen, leading to numbness, tingling, and even nerve damage. Studies from Mayo Clinic show that people with high cholesterol frequently report numbness in their hands and feet. If you frequently experience unexplained numbness or tingling, it's worth getting your cholesterol levels checked. 4. Persistent headaches. Your brain is struggling. If you suffer from frequent headaches, especially around the temples, your cholesterol might be the culprit. This happens because high cholesterol can restrict blood flow to the brain, forcing blood vessels to work harder and increasing pressure leading to headaches. The CDC reports that 94 million adults in the US have high cholesterol, putting them at risk for stroke and other serious conditions. There are some main following warning signs. Headaches that don't go away easily. Dizziness or lightheadedness. Headaches that worsen with physical activity. If your headaches feel persistent and throbbing, they could be a sign of restricted blood flow due to high cholesterol. 5. Shortness of breath. A hidden heart warning. Do you feel out of breath, even with mild activity? This could be a serious warning sign of cholesterol-related heart problems. Imagine breathing through a straw. This is what happens when arteries supplying the heart and lungs become clogged with cholesterol. According to American Heart Association, up to 70% of people with high cholesterol experience shortness of breath. Here are some main signs to watch for. Feeling winded after short walks. Chest tightness along with shortness of breath. Increased difficulty breathing when lying down. If you're struggling with unexplained shortness of breath, see a doctor immediately. It could indicate that your heart is under strain. 6. Fatigue and low energy. Your body is overworking. Do you wake up feeling exhausted, even after a full night's sleep? Chronic fatigue could be a sign that your heart is working overtime due to cholesterol buildup. It happens because your body relies on oxygen-rich blood to function. When arteries get clogged, the heart has to work harder, leading to chronic fatigue. Here are some main symptoms to watch. Feeling sluggish all day. Difficulty concentrating. Needing frequent naps to stay alert. If you're constantly tired, it might not just be stressed. Your cholesterol could be draining your energy. 7. Chest pain. The most serious warning sign. If you ever experience chest pain, do not ignore it. Chest pain can be a sign of coronary artery disease, CAD, a life-threatening condition caused by cholesterol plaque blocking the heart's arteries. American Heart Association shows that CAD is the leading cause of death in the US, responsible for 697,000 deaths annually. It's a shocking statistic. Here are serious warning signs you must know. Pressure, tightness, or burning in the chest. Pain that spreads to the arm, neck, or jaw. Pain triggered by stress or physical exertion. If you experience chest discomfort, seek medical attention immediately. It could save your life. 8. Memory problems. Your brain needs blood flow too. Cholesterol doesn't just affect your heart, it also impacts your brain. According to Neurology Journal, high cholesterol increases your risk of dementia and Alzheimer's by restricting blood flow to the brain. The followings are main signs to watch. Forgetting things more often than usual. Struggling to concentrate. Feeling mentally foggy. If you've noticed cognitive decline, don't ignore it. Your brain may not be getting enough blood flow. 9. Cold hands and feet. A sign of poor circulation. Do your hands and feet feel freezing cold, even in warm weather? This happens because cholesterol narrows your arteries, limiting blood flow to your extremities. Pay attention if you also have pale or bluish fingers and toes. A tingling sensation in your extremities. 10. Skin discoloration. A sign of blocked arteries. If your skin looks pale, bluish, or patchy, it could mean your blood isn't reaching all parts of your body properly. According to the American Heart Association, cholesterol buildup can cause peripheral artery disease, which affects millions globally. If your skin suddenly looks different, get your cholesterol checked. 11. Digestive issues. Your liver might be overloaded. High cholesterol overworks your liver, leading to fatty liver disease, gallstones, and digestive discomfort. Symptoms to watch for are pain in the upper right abdomen, feeling bloated or nauseous after eating fatty foods. 12. Erectile dysfunction, a warning sign for men. Many men don't realize that erectile dysfunction can be linked to high cholesterol. When arteries are blocked, blood flow to important areas is affected. The Journal of Sexual Medicine shows that men with high cholesterol are significantly more likely to experience erectile dysfunction. Now, we'll explore how to control your cholesterol naturally. If you recognize any of these signs or have concerns about your cholesterol levels, here's what you need to do right now. 1. Schedule a cholesterol test. Regular checkups are crucial. Many people with high cholesterol don't have symptoms, so a blood test is the only way to be sure. 2. Make small lifestyle changes such as eat better and exercise. You can eat more oats, beans, and nuts, which are rich in fiber, avocados and olive oil, which include heart-healthy fats, fatty fish, which include omega-3, to reduce LDL cholesterol. Move more. 30 minutes of daily exercise lowers cholesterol. Strength training and cardio are both beneficial, and avoid processed foods and trans fats, sugary drinks, and excess alcohol, smoking, which damages blood vessels. 3. Share this video to help others recognize these signs. Take action today. Your heart will thank you. Recognizing the early signs of high cholesterol can be the key to preventing serious health complications. While many symptoms might seem minor or unrelated at first glance, they are often indicators of underlying issues that should not be ignored. The good news is that high cholesterol is manageable through a combination of medical intervention, lifestyle adjustments, and dietary changes. Please note that this content is solely intended for educational and informational purposes, and should not be considered as a replacement for professional medical advice, diagnosis, or treatment. If you have any medical concerns, it is always best to consult with a healthcare professional. Please do not delay seeking medical advice or disregard such advice due to the information presented here. While we make every effort to provide accurate information, errors may occur, and medical practices, protocols, and treatments may evolve over time. Thank you for watching. If you found this information valuable, please like, share, and subscribe to our channel. Your support helps us continue bringing important health content to more people. Comment below. Do you have any of these symptoms? Have you ever had a cholesterol test? Let's discuss and share your experiences in the comments. Turn on notifications so you never miss an update on your health. Take care of your heart, stay informed, and be proactive about your well-being. See you in the next video.